Welcome to Health Matters, a podcast presented by Wellmark, Blue Cross, and Blue Shield, where we invite Wellmark experts to discuss healthcare and health insurance topics that matter most. I'm your host, Kareem Amiri. Welcome, everyone. As many of you know, at Wellmark, Blue Cross, Blue Shield, our mission is to make healthcare better for our members, customers, and communities across Iowa and South Dakota. We have a responsibility to manage healthcare affordability for our members and customers. And today we're going to explore a piece of the process that many of you may not know or have awareness around, and that is payment integrity. To discuss that, I have Heather Rodemann with me, Director of Payment Integrity for Wellmark. Welcome, Heather.
Thanks. It's so good to be here. We get to talk about one of my favorite things.
That's awesome. I'm glad you're here because I need the education on payment integrity as well. But before we do that, can you give us a little information on your background and the team that you work with?
Absolutely. So I joined Wellmark about 2.5 years ago. I've got about 22 years total payment integrity experience. I really got into the payment integrity space because I had a passion for affordable health care. I wanted to make sure that I could be part of the solution for that. And I'm so fortunate at Wellmark that I have an amazing team that I get to work with. I think combined, I added it up, and there's about 500 years of payment integrity experience combined on the team. So they are just a wealth of knowledge, primarily made up of coders and nurses who also have their coding certification. So a lot of brain power, a lot of expertise, both from a payment integrity as well as from a Wellmark perspective.
That's fantastic. I don't think I realized we had that much experience on the team. So glad that they are doing that work for all of our members
and
wonderful. Customers. So one other thing before we dive in, and if many of you who are listening to these podcasts are aware, I like to do a little bit of research and dig up some data. But according to the Office of the Actuary at CMS, it is estimated that national health care spending will grow at an average of 5.4% annually through 2028.
Isn't that crazy?
Yeah. And just where we were before to now is probably even crazier. But the next crazy thing is that would outpace projected GDP by 1.1%.
That's insane. Yeah.
And private payers are expected to account for nearly 5%, and I think this is the scary part, 5% of national healthcare spending through 2028.
It's really scary, and it's why it's so important that we focus on keeping it as affordable as we can. Yep.
And with that risk, and we've been throwing out the term payment integrity, like as if everybody really knows what that means. Do you want to talk about that a little bit more and give the definition of payment integrity?
So great question. And I think the definition of payment integrity probably differs a little bit by who you're talking to. From Wellmark's perspective, when we talk about payment integrity, what we really want to make sure we're doing is paying the right claim to the right provider for the right service at the right time for the right amount. So in short, it's let's pay it right. It sounds really easy when you say that. Yep. There's a lot of complexity that goes into it. And I'm happy to share more about that with you as we go on.
So when we think about our customers, our employers, why, and you mentioned a little bit of it just now, but why is it important for them that we are doing this process?
Yeah, great question. Payment integrity is a critical component in managing healthcare costs. As we chatted about a few minutes ago, payment integrity's goal is to ensure the claim is paid right. When we apply our various payment integrity programs to a claim through its life cycle, we're really ensuring that that payment is accurate. So we slice a claim, if you will, several different times. We look at it right when the claim comes in to ensure it has all of the information necessary to adjudicate it. We might stop a claim after we get the medical claim in and want to compare it against the medical records for accuracy. We may also do a review after we've paid the claim to ensure that it was paid appropriately. What that means for our employer group at the end of the day is a reduction in overall cost of care, which translates into premiums lower than they might be otherwise.
So is there an element of like fraud, waste, and abuse to that as well, or is that a different
Great question. Piece? I would say that we have our own SIU team, and so they're going to handle a lot of that fraud, waste, abuse. And what I really want to make sure we're doing is probably more focused on that waste and error side, right?
Yep.
healthcare is so complex. There's so many options for billing. There's different interpretations of CPTs and everything else. It just creates a lot of room for error. And so our job really is, let's make sure that we're removing that error, that the provider is billing appropriately, not because they're intentionally not billing appropriately, but because they may not have the most recent information.
So you mentioned, the experience that your team has. I know at my time here at Wellmark, the payment integrity programs have evolved. Can you talk about how robust we have become over time?
I'd love to. So when I joined the organization, we had a payment integrity team that was on a very fast growth trajectory that I got to join. They were already doing claims editing, they were doing subrogation, and they were building the foundation to do that prepay review where we stop for medical records, as well as that post-pay or retrospective review once a claim is paid. We also were already doing a review of hospital claims, and we have just ramped up or accelerated what we're doing in that space. So some of it is bolting on to existing work, and some of it is brand new work that we've brought in the last 2 years. In addition to that, continuing to look at what do we need to do tomorrow, because we know what we have today is great, but it won't be 5 years from now. So we always need to be thinking of the future.
Yeah, always in this space, always have to do that. I know, for our large groups, we've started to have conversations and show some things for them. But can you talk a little bit more about what we do share and what information can be shared with clients?
Great question. So one of the things that we've built out and we're now able to share for our groups is what are we doing from a payment integrity perspective direct for them, so that they can truly see what the savings are that we've derived from a payment integrity perspective for their employer group. In addition to that, we're looking at bringing in information when another Blues plan has a claim run through them for one of our members or for one of our groups. How do we ensure that we are able to pull that claim into our payment integrity story so that the group understands not only what the savings look like when Wellmark adjudicates the claim,
right,
but if they have a plan member who's visiting in Florida for the winter and they go to the doctor, how do we ensure if there's payment integrity savings associated with that claim that we can pull that in and tell that story as well?
I know that's important to a lot of our national accounts.
It's critically
that's a big
important.
Deal. Yep. And so we're working towards getting that.
We absolutely are, and we're really excited to be able to show that story in the future.
Yeah, so that, to go a little deeper, what we call those blue card claims, so those out of network, that's the process we're talking about.
That's exactly the process. I hate to use industry terminology because I never know who knows what. So,
exactly. So, we do get this question from customers. They have vendors approaching them. Can they carve out or do payment integrity services with another vendor?
The short answer is maybe. The longer answer is there's a lot of complexity that goes into that. There's a lot of work that goes into payment integrity. There's transferring of claim files. There's medical policies that need to be reviewed. There's proprietary information that we can't share with anybody else. And so working through those dynamics might create some challenges. What I would say is I have every confidence in our payment integrity program and the two-prong approach that we take to ensuring that we're paying claims appropriately. And what that two-prong approach is really that how do we continue to add to what we have in place today, and what do we need to do differently tomorrow so that we continue to evolve with the market and are offering a best-in-class program.
Yep. Thanks for that. And I know in the past when I've been asked that, I think because people didn't realize that we were doing it, that's why they were asking. But hopefully going forward, because we are talking about it more, providing more information, that's not a question that'll need to be asked.
Exactly. And one of the great things, right, is with the reporting that we have now, we're able to sit down and have a really transparent conversation about what we're doing and how we're doing it.
Yep, I agree. One thing I wanted to get at is overall savings for Wellmark. What does that look like when we're applying these programs?
Great question. It's a big number. So in 2023, It was about $300 million in payment integrity savings.
Wow. So when we think about that and those big dollars, is there any impact that, from a member experience perspective, that they may feel this?
Hopefully, the only way they're feeling it is that their premiums aren't increasing as much as they otherwise might.
Right.
We really want it to be seamless.
Yeah, and we talk about trend, and we have some of the lowest trends in the industry, and this is one of the components that leads to that.
Yes.
I think we've hit our time.
Okay.
So
well,
is there anything else you wanted
here
to share about payment integrity?
Everybody should want payment integrity.
Okay, I agree. Credit cards, all kinds of stuff.
There's
right?
a lot of reasons for it. Yeah.
Yep. Well, I appreciate you taking the time with us today. Unfortunately, our time is up. But if anyone has any questions or would like to explore this topic further, please reach out to your Wellmark account manager. Thank you.
Thank you for having me. Have a great day.
Thanks, Heather. So if you want to continue the conversation about today's topic, please reach out to your Wellmark representative. And thank you for tuning in to Health Matters, a podcast presented by Wellmark, Blue Cross, and Blue Shield. Take care.
This podcast is brought to you by Wellmark Blue Cross and Blue Shield of Iowa and South Dakota. Wellmark Blue Cross and Blue Shield is an independent licensee of the Blue Cross and Blue Shield Association. To learn more about Wellmark, visit www.wellmark.com.